Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Public Health on Call's first episode was released on March 3rd, 2020, when there were 1,922 documented cases of COVID-19 around the world, with just 21 known cases in the United States. 1 year later, more than 28 million people have tested positive in the U.S. The pandemic has killed nearly 500,000 Americans and more than 2.4 million people around the world. In over 260 episodes, we've brought evidence and experts to help unpack the day's COVID-19 and other public health news. This podcast has been downloaded over 4 million times in the last year, thanks to listeners like you. In recognition of the 1-year anniversary of the podcast, Public Health on Call is going live. In addition to our regular episodes, you can join us for a live episode at 11 a.m. every morning, starting Monday, March 1st through Friday, March 5th on the Johns Hopkins Bloomberg School of Public Health's Facebook page. We'll be talking to national leaders and experts on COVID vaccines, health equity, and mental health, and hearing from a top public health official about the state of the battle against the pandemic. We'll also be taking your questions from the comments for a special finale Q&A on Friday, March 5th. You can learn more about the full lineup at Johns Hopkins SPH on Facebook, and be sure to tune in live for the first session on Monday, March 1st at 11 a.m.
Today, our topic is predicting epidemics, and my guest is a familiar voice to listeners of the podcast, Dr. Caitlin Rivers, Senior Scholar at the Center for Health Security at Johns Hopkins. We talk about an effort now underway in the federal government to essentially establish a national weather service for pandemics. Let's listen. Dr. Rivers, thank you so much for joining me. In National Security Directive 1, President Biden established the National Center for Epidemic Forecasting and Outbreak Analytics. First, did I get the name right?
Yes, that's right. National Security Directive 1 directed the National Security Advisor to develop a plan for this center. And so we will be watching eagerly to see what that plan consists of over the coming weeks and months.
Now, I know that in your work for quite a while, you have been talking about the need for this kind of center. So could you maybe take us back to, why this may be important and what this really is?
Sure. So every outbreak, every epidemic, which happens about every other year, putting aside seasonal influenza, which does happen every year, there is a need for modeling. There is a need for forecasting. There is a need for the kind of sophisticated data analysis that can give decision makers the information they need to know how to respond and to know where to direct resources and where to plan clinical trials. And right now, most of that work is being done in academia. And that's how I got interested in this idea when I was in grad school. I provided that kind of decision support to the DoD and later moved on to be in the federal government myself. And I realized there's an enormous need for decision makers to have these kinds of forecasts and analytics. And there's just not capacity inside the government right now. And so just so I understand, there are grants that are given to academic centers to do a model here, a model there, for example, but there's not like a dedicated resource that is like constantly tracking epidemics. Is that what you're saying? That's right. There's a few small groups within government who do this kind of work, but they get quickly overwhelmed when there is a crisis. And it falls to academics who have grants, who may work on other infectious diseases to really provide that backup.
And why isn't that enough?
Because when there is a crisis, there are a lot of decisions to be made, and those decisions are very costly in terms of lives saved, in terms of the economy. And so we need to fund and structure our epidemic preparedness to really account for those serious situations.
Is there a parallel here to the National Weather Service?
Yeah, absolutely. The National Weather Service is a great model for how we can structure a federal agency to do the kind of research and development, the operational support, and the communication with the public to warn when things are happening, when people need to take action. And so that's a great inspiration for what this kind of center could look like.
And the National Weather Service also makes a lot of data available to others who then, put together special types of forecasts and other things like that.
That's right. There are a lot of different industries that are informed by weather forecasting because they are so good about making their data and analysis public. And I think we've only just begun to scratch the surface for what a forecasting center, an epidemic forecasting center could do in terms of those secondary uses.
How good do you think forecasting is for infectious disease outbreaks, for example, compared to predicting snowfalls or big storms?
The big challenge with epidemic forecasting is human behavior. We change the course of an outbreak by the decisions that we make. And so right now, accuracy is really good about 2 to 4 weeks out. I think with additional investments and additional effort, we could improve the accuracy even more. But we're probably not going to get to the point where we can predict the winter snowfall like the Farmer's Almanac tries.
I see. In other words, if we had a center now, it might say in Los Angeles, here's the trajectory for the next 2 to 4 weeks, for example. But
yeah, exactly.
And then it would depend on what people in Los Angeles actually do, what might happen after that.
Yeah, that's exactly right. And you can imagine this being used for seasonal influenza. This could be something we come to rely on every year, in addition to the kinds of crises like Ebola or Zika or COVID that we have faced of national import.
So this could even inform where supplies should be positioned, for example. Like looks like we're going to need more ventilators in the city in a couple of weeks.
That is a common use. That is a way decision makers have used forecasts in the past. Another one is to plan clinical trials to know where to enroll patients because we're expecting a surge in a particular place.
I remember reading that some of the clinical trials that were set up during the first surge, by the time they actually got set up, there were no patients for them.
That's exactly right. And that's a pretty common situation. That was a really big problem during the 2014 Ebola outbreak.
So what's the path from here to a National Center for Epidemic Forecasting and Outbreak? Is it analytics or analysis?
Analytics, I think, is the...
Okay, got it. What's the path from here to there?
Well, the National Security Council will be developing a plan for what this will look like and what it will do. And so I think what is in that plan will be of enormous interest. But the more urgent priority is ensuring that the money that has been requested in the American Rescue Plan makes it through negotiations and comes available to support this effort. I think with a budget, the center could really do important things.
Do you have a sense of how big the funding needs to be for this to be viable?
Probably on the order of $150 million a year.
Got it. And so they'd have a staff, physical location somewhere, and they just get to work looking for epidemics.
That's the hope.
Do you envision that this would also be involved in like spotting the novel epidemics, or is that a different kind of question? Or it's more like once something starts to evolve, this can then predict what's going to happen to it, as opposed to, is the next virus coming from bats or some other animal reservoir?
Predicting emergence is very hard. I don't think that is on the near-term horizon. It could be a longer-term goal, but I see this forecasting center being more successful analyzing and forecasting outbreaks that have already kind of started to take hold.
Got it. Do you think there will be a epidemic forecasting channel, like the Weather Channel, someday?
I haven't thought about it. That could be interesting. At the very least, you could get a notice on your phone, maybe when you check the weather, that might remind you that it would be a good time to reach for a mask or to be vigilant about hand sanitizer. I can imagine prompts that would help people to keep themselves safe during flu season, for example.
So I'm going to follow up on that with a more serious question, which is, we don't know the full course of the COVID pandemic. It looks like vaccines are incredibly helpful. We don't know the full depth of vaccination coverage that we'll get in this country. We've got issues with variants of the virus. Could be that one scenario is the virus is with us and kind of comes and goes a little bit. It surges in a particular area. We all put on masks. It goes away and things change. First of all, do you think that's a fair option of where we could be headed? And second, how could a center like this fit into that world?
I do think we will have to manage COVID long term. I think having vaccines available is a really important resource because we can protect people, but it will be a very difficult disease to get to zero. And so I think we are having to look over the longer term. And I definitely think this kind of center could be useful for COVID, just like seasonal influenza. Viruses that we live with all the time, we are able to change the outcome and we're able to change the trajectory, but it really depends on people changing their behavior and making those changes. And in order to do that, we really need to know what's happening in our communities. And I think this kind of center could be really important for making that possible.
I mean, you really could imagine checking the weather forecast to grab an umbrella and the epidemic forecast to decide whether or not to be wearing a mask.
I think that's right. I think mask mandates will not be with us forever, but I think people choosing to keep masks around in the wintertime, that does seem like the kind of thing that could stick. Knowing when to pull it out of the closet would be really helpful to making it effective and easy. And I think that's a big opportunity for us.
Got it. Well, I'm going to be watching this with a keen attention to see whether this makes it through, it gets set up, and becomes another way that we can learn about the world we live in and get information to protect ourselves.
Thanks for having me on.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.